As you recall, as a main part of patient evaluation, we perform a history as well as a physical examination of the patient. So for today's purposes, during our physical examination, I would ask to remind you of the cardinal techniques of any evaluation, including inspection, auscultation, percussion, and palpation. You'll see these various techniques being performed as we examine our patient today. The main components of the dental examination can be divided into three parts: the general survey, the intraoral examination, and the extraoral examination. The general survey should occur during the time that you're taking the medical history of the patient, where you notice various lesions or various sores or perhaps gross asymmetry of the patient's face and exposed skin. Notice if there's any distress on the patient's eyes, if they look like they're under a significant amount of stress. Notice as they walk into the dental operatory whether they have any impediment in their movements. Notice as you begin to discuss the history with the patient to see if in fact they have any difficulty in communication. During the general survey, you might notice also some facial lesions, things such as moles, discolorations, rashes, once again on the exposed skin, including the ears. Notice that if there is a significant amount of hair loss, all of which could relate to various underlying medical conditions which may be important to review with the patient before you begin. Included in the general survey is also some notice of the patient's respiratory pattern, whether they're breathing without any significant distress, whether there's any different coloration of their face, and whether they seem appropriate to the weather outside, the temperature outside, and if they're grooming properly. So the oral dental examination usually is divided into two components: the intraoral examination as well as the extraoral examination. We'll perform both of those components on our patient today. For the extraoral component, this includes a head and neck examination, an examination of the thyroid glands, an examination of the salivary glands, a temporomandibular examination, as well as a cranial nerve examination. We will review all of these in the next modules ahead.